Hey everyone, I'm Dr. Kylie. Today I'm going to teach you my 50, 60 favorite systemic supplements, how I use them, the dosage, and powerful combination. Because let's face it, the more simple we can keep this stuff, the better our patients like it. I know for a fact that when I have people coming in and they're like, I used to take 25 pills 4 times a day, I think I wouldn't do that myself, so I'm not going to require you to do that. And as you guys well know, they probably aren't making very much progress. So then when you can say, oh, you only need to take these 3 or 4 things every day, twice a day, 2 capsules each, that's a big change for them. I'm a big simple person, love simplicity, so do most patients. So I'm going to teach you guys everything I have on the shelf in the next 30 minutes, but here's the caveat. I don't know everything in the catalog, nor do I plan on knowing everything in the catalog. But what I do know is that these 50-ish supplements that I use, it's 98% of what I use, and they work tremendously well. Here's the other caveat. I don't know jack crap about what supplements, what ingredients are in each of these. I just don't, and I don't care to know them. All I know is that they work, and that's what I care about. So don't stress about knowing everything in the catalog, and don't stress about knowing the ingredients. If you have a question about the ingredients, ask Mike. He can answer it for you. Okay, here we go. From top to bottom. This one is the Dermacolonizer. It is a great combination with Renovator. So you put this on the skin, psoriasis, eczema, vitiligo, all of these skin conditions. In fact, I put this on my 9-month-old daughter on her diaper rash, and it's worked really well from preventing the diaper rash. Even when it starts to come on, we put this down and it helps it. So what I recommend is counterbalancing the Renovator and the Skin Colonizer. I would grab Renovator, but it's not on my shelf anymore. I'm out of stock with it. So in the morning, apply Renovator to the topical areas that need application. And then at night, do the Renovator. And just switch it up like that every single day, and you'll be surprised at how healthy the skin microbiome is with those two things. You got all of your kid stuff. If you guys have kids, I have a 3-year-old. I put him on Tough Play, Fun Play, and then Brainy Play is the other one. Don't have that on the shelf. Brainy Play, I swear to you, the kid is smart, but he doesn't forget a dang thing with that. And I don't give them to him every day. I probably give them to him once a week along with vitamin D. He doesn't ever have a problem with the flavor, but I've been giving him these for at least 18 months now, so he's probably used to it. I highly recommend you get those kids on it that you have patience with, and also your kids. The Fun Play is multivitamins and minerals. The Tough Play is the immune booster. Add that with some vitamin D. We are now in the middle of February, conquering past all the COVID crap. Nobody in my house has got sick. Cool stuff. Ecovirum, I'm out of that. Ecovirum is part of my gut destruction phase, but it can also be the gut replenishing phase too, because Ecovirum has 2 powerful components. One, it can attack E. coli, and then 2, it can act as a prebiotic for all of your probiotics to feed it. And then it's a liquid version, so you can easily manipulate the dosage. I usually start people off with 1 dropper, 1 time per day, and that seems to suffice. Enzy and Mela and Z-gluten. Enzy, Mela, and Z-gluten are the enzymes I often include with the gut replenishing phase. Z-gluten is exactly what it sounds like. It's going to help your body, help your patients' bodies break down gluten. Enzy, high potent enzyme production. And then Mela, of course, is also enzymes. I rotate my stuff. So I'm 1 month I do Z-gluten, the next month it's Enzy, the next month it's Mela. So rotate your enzymes. I'll also rotate the omega-3s, the healthy fats, and I will rotate the probiotics, and we'll get to that. But when you're rotating supplements and not keeping people on the same supplements for month after month after month, they feel like they're progressing and they love that. And then, of course, the gut needs variety. So that's always helpful too. WO. I have my patients do WO in the gut destruction phase. And I don't know hardly anything about this, let's be real. But what I tell my patients is that it's the Chinese medicine cabinet in a bottle. You can take this internally. It has antibacterial components. But really, what I tell my patients is it's going to help you handle the destruction that your body is doing, the work that it is doing, whether you're killing viruses, parasites, fungal components, or bacterial components, this will help. You can do 5 drops in half a cup of water and then drink it. I start my patients by rubbing it on the bottoms of their feet. That's one less thing your GI tract has to worry about. And then they don't feel like they're just popping pills, whether they're natural or not. Next up, we have 16B. And the combination with 16B is nerve and nerve. If you are a chiropractor working with nerve pain, like sciatica, add this to your patient's routine, 16B and nerve. And if you're worried about the B vitamins, throw in some more to make sure that they methylate those and use those properly. That will really help the nerve pain, right? And 16B, you guys haven't taken a look at the ingredients. There's like B20, B16, B13, B vitamins I didn't even know existed. And my bachelor's degree is in nutrition. So take a look at 16B, throw in some more as if needed, especially if you have the nerve pain. Or I also use 16B and mores when on the CBC, if their CBC is off, those 6 markers, RBC, MCV, MCHC, those 6 markers, if they are above the ideal range, give them B vitamins, but more importantly, give them mores. So their body can utilize those B vitamins more efficiently. Then one caveat with the 16B, I have had people experience a niacin flush. So I start them off at 2 per day in the morning. If they do have that niacin flush, we back it off to 1 per day. ABC and MBC are the probiotics. ABC is the lighter version. MBC is the powerful version. MBC is also in prep phase. So I rotate these. I can't wait for Shane to come out with more probiotics because I love to rotate them with 3 things at a time. And I know he's getting the neurobiotic back out again. So I'll rotate the neurobiotic with ABC, MBC. Start with MBC for a month, go to ABC, and then when it comes out, the neurobiotic, probiotic. And guys, tell your patients this too, because they won't understand and they won't remember that these probiotics are guaranteed shelf life. The stuff that they're buying at GNC and Costco and Walmart and even Amazon, what is on the label is not guaranteed. This stuff is guaranteed, and it's guaranteed for like 4 or 5 years as far as I understand. Okay, ACP and ACX. ACP is like a mild version of, hey, I'm starting to feel a tickle in my throat. Take some ACP, it's going to help your body flush it out. ACX is the, I'm getting a cold. I don't feel so good, I'm getting sick. Take ACX to flush it out. 2 per day, maybe 2 in the morning, 2 at night to really get the flush going. It literally is just a high-powered vitamin detox with A, C, and E in it with a bunch of herbs as far as ACX goes. This is like my husband's favorite stuff in the winter time. As you know, those male colds, right? Okay, CVO's next. CVO, I'm going to rotate CVO with RPM and Vista 1 and Vista 2. These are my omega-3s and healthy fats. I always incorporate these with any hormone stuff. You've got to have healthy fats in the body to make hormones. Cholesterol turns into testosterone, estrogen, progesterone, and even cortisol. So start off with CVO, RPM, then Vista 1 and 2. Here's some other cool things with CBO. Lipid panels, cholesterol triglycerides, get this guy in. Joint pain, get this guy in. CBO is probably one of my favorite products for a plethora of things. And the way I tell people is it's just going to help lubricate your joint, or it's going to feed your body with supplies it needs to make estrogen, testosterone, progesterone, that good stuff. I use a lot of CBO. Next up is vitamin D. You've got capsules and you have liquid version of vitamin D. Depending on who you're working with, just ask them. Do you prefer liquid? It tastes like orange soda. Or do you prefer capsules and vitamin D? Now, I've done some research on some vitamin D levels. In fact, I did some research the other day about a doctor who was jacking up people's vitamin D in regards to MS, psoriasis, and vitiligo, these autoimmune conditions. He had them at 35,000 IUs per day for at least 3 months. Now, of course, you always want to test beforehand, but the vitamin D normal levels of testing is between 30 and 100. People who are sitting at 30 feel like crap. Anxiety, depression, SAD, people who are at like 100 or 80, I always shoot for that 80 range. That's when they're like, oh, I feel better. I'm not fighting the anxiety or the depression as bad as I used to. So that was said, he was doing 35,000 IUs. My recommendation and what I do with all of my patients, mostly at the beginning, because I do pull their labs, and I've never seen someone's vitamin D above 45 on a lab unless they followed my vitamin D protocol before testing. Okay, 25,000 IUs of vitamin D per day. So it's basically 5 capsules, 6 or 7 droppers for a month. Then back down to 20,000 for month 2, back down to 15,000 for month 3, and then maintain at 10,000 for month 4, 5, and 6, and as long as they need it. People are taking a standard dosage of 2,000 to 5,000 IUs of vitamin D per day. It's not going to cut it. And when you ask somebody if they're taking vitamin D, they'll say, yeah, I am. Okay, well, go get it. Let's see what the dosage is, and it's very minuscule. And then you say, oh, well, we got to take 25,000 IUs of that, and that's going to be 75 pills. Oh, let me give you mine instead. It's 5 pills. They're very easy to jump on it. Anxiety and depression is the first thing I do. And in fact, I preach this all over Facebook and my podcast, and people do it and they feel a dramatic response. Don't worry about the toxicity levels. You're not doing this for years at a time. And learn about the toxicity levels of vitamin D. They probably aren't what you think they are. Minerals and PTM. Minerals I include with all thyroid stuff and all hormone stuff in general. You can also include it with anxiety and depression to make sure they are getting the support that they need. And one of the easiest ways to help someone learn if they are mineral deficient is if they have white lines on their nails. That would be a zinc deficiency. Sometimes they got them, sometimes they don't, but just include the minerals. I just go 2 per day because it's going to last a month during any type of thyroid stuff. And then also hair. Women are complaining about their hair, postpartum hair, thyroid, hypothyroidism hair. This will help strengthen their hair. I know I take this for sure postpartum to help my hair regrowth. And I've got like all these 2 and 3 inch long hairs all over my head. Thanks to this guy, my hair's growing back. PTM, potassium. I used to use this a lot with hormones, but I don't use it so much anymore, but it is potassium, magnesium. You can use that for leg cramps as well. And then we get into rocks. So we have a couple different antioxidants here. Rocks, Epic, and G-Cell. I like to incorporate these antioxidants when I'm doing any type of leaky gut. So the way I do it is I have L-Gut, Vista 1 and 2. That's my leaky gut healing protocol. And then I add in one of these each month. So I start off with rocks, and then I go to Epic, and then I go to G-Cell. Why? Because we're going to heal the leaky gut lining, and then we're going to protect it with antioxidants. Tell your patients that. Heal the lining, protect it, protect the cells with these antioxidants. And then, of course, rotate them so they feel like they're always taking new stuff. TMI, I don't use much TMI. I rarely did at the beginning. I just am floating on the whole iodine thyroid thing. And so if I'm going to do the thyroid thing, I'm going to take care of the 4 factors that are destroying people's thyroid: stress, inflammation, gut, liver. Okay, let's see. Let's go back to here. On this side, I've got Calm. Calm is a wonderful anti-anxiety. I got people taking it like crazy during the last 8 months. If you're dealing anything with anxiety, start taking Calm. However, you cannot take Calm with an antidepressant in regards to SSRIs. They don't mix, but Calm is a great factor. In fact, Calm, GA, and Stimulant are my magic 3 sleeping combinations. I have them take 2 or 3 of each before bed. If they can't fall asleep or stay asleep, that's the magic combo. Calm, GA, Stimulant. Now, of course, GA is going to lower the cortisol levels. Stimulant is going to balance the blood sugar. They got to go hand in hand. And then Calm has the GABA in it, which is what should take over our brain so we can fall asleep and stay asleep. But if GABA is not present, or these guys are in the way, you're going to wake up in the middle of the night and not be able to fall back to sleep. So any sleep issues, Stimulant, GA, Calm. You can start with 2 of each at night before bed. You can even go up to 4 of each at night before bed. Gold is the immune system protector. It literally has immune system components like golden seal. Vivi, I don't have any Vivi on my hands because Vivi is probably the most common product I sell outside of vitamin D. Because when you're giving people 25,000 IUs of vitamin D, you probably need 5 or 6 containers of it for the next 3 months on that 25, 20, 15 dosage. So Vivi is the antiviral. Here's how you know if they need it or not. You pull their blood work. CBC with differential. That's all you need. Viral components are high lymphocytes and high monocytes. Lymphocytes, if they are above 30%, we got to attack a low-grade hidden virus. Monocytes, if they are above 7%, we got to attack a low-grade hidden virus. Use Vivi to do it. VIVI, 3 per day for 10 days, and then 1 per day for 30 days, because there's only 30 capsules in the container, and I've done that with everybody for the last 18 months, and it's worked really well. So that's Vivi. DB12 DS, great digestive support. Digestive enzymes with B vitamins and DB12, and then Digest S is for great digestion support. I use it specifically with the gut replenishing phases in regards to hydrochloric acid and helping with them with the GERD, the gas, the bloating, that fun stuff. Okay, when it comes to adrenals and thyroid, you got to fix all 3 at the same time. When it comes to the thyroid, there are 3 key pieces of fixing the thyroid going upstream. So you have the adrenals that directly impact the pituitary, which produces TSH. So if TSH is low, you got to think adrenals, pituitary, and then of course boost your thyroid if T4 and T3 are struggling. So here's my thyroid protocol. GA, adrenals, GB, pituitary, GF, thyroid. 2 in the morning, 2 at night for a month. Next month, 2 in the morning of each, or 2 in the evening, depending on their sleep patterns, if they need the GA. Then in addition to the actual capsules, I've been taking the liquid version of each. So I've got CXGA and CXGF. I have them apply the liquid version right over their thyroid or in their lower back where the adrenals sit on top of their kidneys. And then that way, it's just another way for your body to heal and not go through the digestive tract. Less pills to take as well. Rub this on your thyroid, rub this on their adrenal glands. I start off around 10 drops morning and night of this. Bottom on the bottom of my shelf here is Bind. I ran out of it yesterday. Bind combined with LS. If you're having a female who has heavy, painful periods, Bind and LS are genius. You can actually lower the painfulness and lower the heaviness of their next cycle by simply having 2 Bind or 2 LS in the morning and 4 Bind somewhere in the middle of the day where they're not taking other things with it, right? So with Bind, you need to have 2 hours before, 2 hours after, nothing else. It will bind to it and it will just be expensive tea. You tell them that, they will always remember. LS and Bind, heavy painful periods, endometriosis. It's also a very simple way to detox. And if you want to add in Enzy is a great one too. It's got milk thistle that will help drive the detox pathways. Remember how I said I don't know the ingredients? That's the only ingredient I know is milk thistle in this. So there's your powerful combination for heavy painful periods. You help a girl out with that, she's gonna love you forever. Okay, moving to the top of the shelf here, we've got energy. This is in regards to cells, mitochondria, Krebs cycle, all that fun stuff. Energy is gonna help your body take proteins, fats, and carbohydrates and turn it into energy in the form of ATP. I use this probably very last in my phases. I want to make sure the gut's working well, get the systems, get the elimination system going well. I want to fix the hormones, then maybe detox, and then focus on the cells with energy, Epic, and Eventa. Eventa, if you guys use the O test, the organic acid test, there are a couple specific markers for arginine. Here's your arginine source right here with Eventa. Femecrine, those of you who have PCOS, or if you're working with people who have PCOS, polycystic ovarian syndrome, that means that their periods are kind of sporadic. They're typically light, whether they have a diagnosis of it or not. I highly recommend this. Femecrine, Sinulin, and PS. Now, if I'm doing a 3-month protocol of this, which I typically am, I'm going to rotate my organs. Okay, so they're always going to say on Femecrine 2 per day, maybe 2 and 2 if they need a high dosage of it. Sinulin, 2 in the morning, 2 at night. PS is the first month, so it's focusing on the pancreas. Next month, I'm going to focus on the liver with LS. And then the 3rd month, I'm going to focus on, where's my KS? KS, the kidneys. So that way it's 3 months worth. They're sticking with these 2 powerful top dogs, but then we're rotating them through the organs to make sure they feel like they are progressing and moving forward. And I'm telling you guys, whether you're struggling, you know, people who are struggling to get pregnant with PCOS, they're struggling to lose weight with PCOS, 3 to 6 months with those 3 things, and then add in some Catavo shake if their breakfast stuck. Those 3 things with the Catavo shake, I haven't had it take longer than 6 months for someone to get pregnant with PCOS. Of course, manage the diet along with that, but this stuff works and it works really well. Okay, Moore's is the methylation. Don't overthink methylation and THFR. It's a hot topic, but I actually have a lady who's a nutrigenomics specialist who's going to be joining me on my podcast here in a couple of weeks, specifically talking about how multivitamins can alter your genes, and then also the methylation component. And she's not big onto just taking methylated vitamins just because we can. So I like to have MORS because MORS is going to help the body do the work itself. It's not going to just say, oh, this is methylated folate and methylated blah, blah, blah. This is what your body needs to convert B vitamins that you're already eating into the usable form. MORS is pretty powerful. And I believe homocysteine TLR, I think is what it's called. That one's a good combination with it too. Then we got Neurosin. If I knew Neurosin existed during medical school, I would have eaten it like candy. This one, GA, Sinulin, those are in my toolkit. Vitamin D as well. My toolkit to where if I'm laying in bed at night, my brain is going a million miles an hour, but my body is exhausted, I take GA. If I'm going from a seated to a standing position, I get lightheaded, I know my blood sugar needs some help, I take Sinulin. This guy, I just take it because I need my brain to function at top notch all the time. Neurosin, the doctor's best friend. Brain fog, Neurosin. All right, we did RPM with the healthy fat rotation. Sinulin, blood sugar balancing, better than metformin. Vista 1, Vista 2, include that with your leaky gut protocol with L-Gut. We've done rocks, TMI, zinc. Okay, then we get into the gut destruction stuff. So Bactrex and FungDX. Bactrex is, of course, what it does is it attacks bacterial infections. You can discover that with the neutrophil marker on the CBC. If it is higher than 60% Bactrex, FungDX is, of course, going to tackle the fungal component, the candida stuff, but it can also be an antibacterial component as well. And for both of these, there's a liquid version. I've been told that the liquid is not easily digestible via the taste-wise, but you can use this topically. So I like to have the FungDX liquid on hand for any candidal infections within the vaginal area. You can have the women apply this vaginally, topically. They're going to love it. Okay, then the parasite stuff. So parasite purge, you're going to have VRMs 1 and 3 in the morning, VRMs 2 and 4 at night. Then I also combine it with the WO oil because, like I said, WO oil is going to help your body handle the work it's doing. And then find. So if you're tackling some parasites, tackling the pretty difficult stuff to get rid of, VRM 1 and 3 in the morning, 2 and 4 at night. I start by doing 6 drops each for the first round, and then I move it up to the 12 drops each for the second round. They're going to complete 4 rounds of it. Each round is going to be where you're 10 days on, 5 days off. That's 1 round, so 15 days. 4 rounds, 2 months worth, okay? You're going to know if they need this stuff if the eosinophil marker is greater than 3%. That's when you know if you need the VRM route. Okay, really quickly, we've got heart cardiovascular, anything that if they have a history of heart stuff or lipid panels off, these guys work well. Combine them with the CVO. We have KS, LS, and PS. We've kind of gone over those already. KS is great for kidney support, of course. KDIR is going to be great for kidney stones, as it's like a diuretic. Liver gallbladder with LB. M plus, boosting testosterone levels. So if you're a female with low testosterone, take some M plus, add in some CVO to give your body the supplies it needs to make testosterone. And then you can even I always add in the blood sugar component too. Underlying all hormone chaos is blood sugar chaos. And then last but not least, we have prep body and brain phase. Those get used very, very, those are probably the most common things that I see people using. I don't think we need to go over them. I use prep body brain phase last. So in my 4 phases, gut destruction, gut replenish, hormones, then detox with the Prep Body Brain. And that seems to go a lot smoother than it has in the past when I'm doing detox first. I have done the Prep Body Brain phases with people with RLS and major muscle cramping. It's worked wonders for those. We in fact we did 3 rounds of it on the one individual who had RLS, and she was able to get off of her medication. But we had to be very careful on how we went around brain phase because it was way too much for her body in that first go around. And she was calling me the next day after she'd been up all night long dealing with restless leg syndrome. So that's another thought for prep body brain phases. And that's a wrap. That's all the supplements I use on my shelf, and I love them. I hope you guys love them too.